This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right. It's really loud tonight, but unlike all of my other medical minutes, this is actually a potentially useful medical minute. So, a week or so ago, working with Ian, we had a pretty bad burn patient who poured gasoline on himself. I don't know if anyone was here for that one. Do you remember that one? So a lot of bad burns that needed to be addressed. Notably, he had significant burns and significant swelling to his fingers and was going to need escharotomies on those fingers. But he had rings, sometimes multiple rings, on almost all of his fingers. So that was an immediate concern. Tried to use our ring cutter, which looks something like a complicated can opener, and really couldn't get it to work, couldn't get the pieces together. Somebody had some fancy trauma shears that had a ring cutter on the back of them. Anybody have those? Yeah. So we were able to cut off about 3 or 4 rings with that, and then got to a ring that was made out of titanium or cobalt or adamantium or vibranium or something, and actually broke the shears. So now we had a guy with really bad fingers, already at risk of becoming ischemic, and he's got one ring that we can't get off. So what do you do? What's next? All right, so what do you do? We're going to come over by Stephen and have him speak to the microphone.
I'm going to get probably some sort of sutures and wrap around their finger and try and pull the ring up.
Yeah.
Finger, and then it'll slowly wrap around and pull
Yeah.
the ring down.
So listen carefully, because you actually may not ever have to cut off a ring again if you use this technique or other techniques. First of all, if they're having a lot of pain and you really feel like you need to yank on the ring, give them a dig block. So that solves that problem. That alone might allow you to just get the ring off if they can tolerate you kind of twisting it. And then what I did in this instance, get our biggest suture, which in this case that we have in our drawer is just a 1/0 Epsilon. You want the bigger the better, because you don't want that fine suture either breaking while you're wrapping it or cutting into their finger. So basically, normally we're really just talking about the PIP joint, right? That's the one where where rings get stuck. Slide the ring as proximal as you can. What I did in this case was just literally tie the suture around the finger and then wrap it tightly all the way up until it was covering the PIP joint. That pushes a lot of the edema distally, and I was able to easily slide that last ring off. So that's one trick, but it's a little bit of a pain and it can be painful. So the other trick is to where did I put it? Oh, right here. Yeah, just take one of our, again, slide the ring proximal, take one of our tourniquets, start distally, and wrap as tight as you can. And just keep wrapping and wrapping literally as tight as you can. And if they can't tolerate the pain, then you can give them a dig block. And you can actually wrap it down until it's over the ring itself. And then assign the patient to hold this and to hold their finger up above their head for like 15 minutes. Come back, take it off, lube, your ring should come right off. And you'll probably never have to cut a ring again. So that's the trick of the day. All right, thanks.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.